guys. They were one of our very first supporters 5 years ago, and they've been a great partner of ours. So Ethan, take it away.
Thank you very much. Thank you all for letting me come up here and kind of explain to you a little bit more about Sciton. To kind of get it started off, Sciton was founded back in 1997. So we're 20 years old, and a little bit of history is if you look down here kind of in the front, we got Jim Hobart. He actually worked for Coherent Medical back in the 60s. And Coherent Medical produced the Ultra Pulse. Is anyone familiar with the Ultra Pulse? Anyone heard of that here? No? So it's actually the first CO2 laser ever created for aesthetics. So our founder built that laser late 70s, early 80s. And as Coherent got acquired by a couple shareholders, they decided that they wanted to branch off and start their own company called Sciton. And Jim Hobart took Dan Negus, who is the PhD president, and we started Sciton, and we did specifically resurfacing. So high downtime, great result, right? And then we started looking into aesthetics and saying, hey, wow, there's a lot of different options out there, and how patients want no downtime versus a lot of downtime. And the cool thing about the Sciton platform is everything's built in Palo Alto, hand-built, custom box to you. So however you want to start your box, you can build it based on what your needs are. So we have BBL for photofacials, Forever Young BBL, Forever Clear, Forever Bare. However you want to start your med spa or dermatology practice or plastic surgery practice, you can start there and add to the same platform as your needs change and as you grow. So here's the platform. So this is the Jewel. The Jewel is where you host all of your modalities on. So you can see there's 3 avenues of delivery. You have the fiber, which is in the back, and most MDs are doing. It's laser-assisted lipolysis, so what's really popular in aesthetics right now. Okay, so Forever Young BBL, for those that you don't know, is an anti-aging protocol developed by Stanford dermatology Dr. Patrick Bitter Jr. Basically, in long run, just the short version about it, if your patient comes back 2 to 3 times a year, like you want them to, like how Alex and Brian have been talking about different ways to bring people into your practice after you correct their skin and get them happy, BBL is a great way to market anti-aging. So if you come to my practice 3 times a year for the next 10 years, we can show you studies related to Stanford saying, hey, I'm 38, by the time you're 48, you'll still technically look 38. You might be wiser, but you'll still look younger. So we have technologies to kind of incentivize our patients once we correct their skin to come back and keep spending money with us, as well as maintaining their result. Because aesthetics is all about correction to how can we maintain their result, correct? So we have BBL, and then we have Halo and our arm delivery. So this is where it can get really interesting, right? So we can go anywhere from a really nice fluff treatment to really low density in the microns, or we can go very aggressive and have a month-like downtime and completely change someone's life from like 65 to 55, right? All within a few months. So one really fun fact about this slide is since 1997, Sciton does not compromise on quality in the slightest. So there's 3,000 custom parts built into the device. So 95% of our lasers that we've built and put into the field since 97 is still in place. So for example, it's a non-obsolete platform because you can add any of this technology at any point. So I'm going to show a couple photos of Halo. Halo is a hybrid fractional laser using 2 different wavelengths, 1470 and 2940. So 2940 is erbium, and 1470 is a non-ablative wavelength, and it's in the same microthermal zone. So 2 wavelengths, 1 column. Acne, that's a life-changing result, right? That's unbelievable. Yes, 9 treatments, but she had a very bad baseline. But this is an alternative to medication that if they're not responding to, or say parents you don't want to put them on. 11 years, 32 treatments later, it's not a whole lot of time, right? It's a quick 20-minute photo facial in and out at lunchtime. Always looking to maximize our treatment time per hour. There you go, right? Add it with your Botox and fillers. You can do that. That's all I got. So thank you for your time. I appreciate it.
Thank you.